Hello, this is Dr. Kenneth Proefrock, and this morning we are talking about botanical medicine in pulmonary conditions, and we'll be discussing case studies. So as an example, some of the things that we'll make quite a bit of are things like ophthalmic preparations, which are considered to be sterile compounded preparations and are therefore sort of have something of a higher risk. So with our first case, let's talk about this underlying condition of ARDS, and then we'll move into the specifics of the particular patient that we'll talk about. So ARDS is acute respiratory distress syndrome. In this current pandemic, this is the worst case scenario and the reason why some people end up dying as a result of their infection with COVID-19. So sulfur-containing amino acids, sulfur-containing agents are pretty good at breaking up biofilms. N-acetylcysteine is one of my favorites. We make it as 100 milligrams per milliliter solution. When you make N-acetylcysteine, and you can buy N-acetylcysteine over the counter, you can buy it in bulk from places online. When you do, recognize that it is itself an acidic molecule. So now this is a patient that's a particularly unique situation. She is a patient that comes to us from France. She was born with brain damage. So one part of our practice, what I do quite a lot of is pediatric neurology. So we see a lot of kids with brain damage early on or drowning and things of that nature. And so this particular little girl, when she comes to us, initially was 6 months old. And she had been hypoxic for a little less than 10 minutes and had a sustained damage to her basal ganglia. And her respiratory tract was really compromised. We also have an issue with a lot of the folks who have chronic pulmonary conditions are resistant to different drugs. It turns out that a lot of botanicals are able to keep people from becoming resistant to drugs. Rauwolfia is one that I use quite often because it doesn't take much. Ozone therapy is rather harsh on tissues. A lot of times we'll do that in ears, up a nose. Breathing it in is really harsh on lungs, but you can put that in your environment as well to break down bacterial growth in the environment. Sometimes we'll do it IV in people.